Hello everyone, myself Dr. Varsha Pawar, and today I'm going to talk about the topic which is related to the kinesiology subject of second year BPTH. The purpose of today's lecture is to learn about the anatomical structures of the vertebra. Now, the vertebral column is very well known as a spine, even though it is termed as a continuous spine or the vertebral column. It is divided into 5 different sections which consist of the vertebrae as well as the intervertebral disc. In total, it will consist of 33 vertebrae and 23 intervertebral discs. The whole vertebral column or the spine is divided into 5 sections, namely cervical region, thoracic region, lumbar region, the sacrum and the coccyx. If we see the region wise, then the cervical region, it has 7 cervical vertebrae, 12 at the thoracic level, then we have the 5 lumbar vertebrae. At the sacrum and at the coccyx region, the vertebrae, they are fused together to form the sacrum and the coccyx respectively. Again, apart from their regional name, they are also divided into 2 types, that is primary curves or the kyphotic curves and secondary curves or the lordotic curves. The primary curve is more of having a kyphosis and the secondary curve will show a normal lordosis position. The typical vertebra is divided into the 2 parts. One is the vertebral body and another posterior part, that is the vertebral or the neural arch. First, we will see regarding the vertebral body. The vertebral body, it is also known as the anterior part of the vertebra. So this region is known as the vertebral body. This is the superior view of the vertebral body. This is the lateral view of the vertebral body. This vertebral body will consist of the superior surface as well as the inferior surface. It is mainly made up of a cortical bone which is further surrounded by a cancellous bone. The structure and the size of the vertebral body helps to resist the compressive forces acting at the spine. Then we have the posterior part, which is known as the neural arch, or it is also termed as the vertebral arch. Now you can see in the diagram this part is different from the vertebral body and it mainly consists of the several processes present on the right as well as the left side. So the first part that connects the anterior and the posterior part is the pedicles. These are the short and stout pedicles. They usually transfer the forces from your vertebral body towards the posterior arch. In the posterior elements, the other structures included, they are the laminae present on both the sides. They together join and form the roof or the covering of the neural arch. Then we have the articular processes, that is superior articular processes as well as the inferior articular processes. On the right and the left side, we again have the 2 important processes, that is transverse processes. So this horizontal projections on both the sides, these are the transverse processes. Then on further, we have the spinous process. So this horizontal long projection is the spinous process, and this circular or this area is known as the vertebral foramina or the spinal canal. So this is the anterior part of the vertebra. This is the posterior part of the vertebra, and mainly they form the boundaries of your vertebral canal, vertebral foramina, or also known as the spinal canal. So these are the various structures, those are related to your vertebra or in general anatomical structures of the vertebra. One is the vertebral body, another is the posterior elements. You can refer these books for the further details regarding the structures. Thank you.